future nurses. Welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I'm going to teach you on how to give oral care for an unconscious patient. Remember, we have oral care for different kind of patients. Some patients are conscious while some are unconscious. So in this episode, I'm going to concentrate only on an unconscious patient, right? So sit back, watch this video to the end. Don't forget to like, share, and subscribe. Thank you. So the next thing is for us now to know our requirements for this procedure. Of course, when you're going to give oral care for an unconscious patient, you don't need toothbrush, right? What you need is mouthwash. Of course, my mouthwash it's ready. Of course, I'm using this product Colgate. It has a mint scent, so it's okay for you to use it for your patients. And sometimes if the patient is if it is harsh, you can dilute it. So you can see I have also have my you can use it's optional. You can use this artery forceps or sponge holding forceps to wrap your gauze around. I have gauze and I have tongue depressor. I have mouth guard and I have clean dissecting forceps. Then I have, of course, I have my jelly, my Vaseline for lip care. You know, you wouldn't want to give oral care to your patients without taking care of the lips so that to avoid cracking. So these are my requirements. And of course, I also have my um yes dressing Macintosh and dressing towel. Then, of course, if a patient is unconscious, sometimes you may have the patient may have excess secretion from the mouth. So my suctioning machine is ready to suction the patient. So do not forget to suction patients whenever you have the patient has a lot of secretion from the mouth. So my suctioning machine is ready and I will suction my patients before carrying out the procedure. So the next thing is for us to introduce ourselves to the patient. Myself as a nurse. So, good morning. How are you today? Please, can you tell me your full name and your date of birth? Okay. Then, as a student nurse, when you're carrying out this procedure, you cross-check the patient information with the one you have in the file, right? So I cross-check, and it's the patient's name and date of birth correspond with the one I'm having in the folder. So then the next thing is for me to take an informed consent from my patients. So before you do that, please, as a student nurse, don't go just straightforward and say, I want to carry procedure, blah, 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 and just do. No, explain, please. Explain the procedure to the patient very well so that the patient will consent, right? So now, please, I'm here to carry out oral care. So, being that this is an unconscious patient, remember the patient will not even tell me his or her name because the patient is unconscious, right? So, I have to like go to the patient's file, cross check, and check twice or three times, or even call another colleague to help me confirm the patient's identity. And in case if the patient is having a relative by the side, you ask the patient's relative to tell you the full name and the date of birth of the patient, right? And you can also take an informed consent from the patient's relative, but whereby the patient doesn't have any patient relative around, then you go ahead after checking the patient. Remember, this is an unconscious patient. So after confirming your patients, you know that this is the right patient you're going to perform this procedure on. The next thing is for you to go and wash and dry your hands. Of course, you have to perform hand hygiene. So follow me, let's go and perform hand hygiene. So after performing hand hygiene, of course, I'm going to put on my glove. Remember, remember, this is a clean procedure. It's not a sterile procedure, so I will not need sterile glove. You can use clean glove to do this procedure. So the next thing is for us now to place our patient. Remember, this is an unconscious patient. You have to tilt the head. I have placed Macintosh and dressing towel already. So tilt the patient's neck to the sides, that which you want to perform the procedure. Before then, also, if the patient is having much secretion, the next thing is for you to on the suctioning machine, of course. On the suctioning machine, the suctioning machine is working. Then you suction the patient's secretion, of course, till the patient till suction the excess secretion. After sucking the excess secretion, you keep flushing the tubing so that the secretion will go right inside. After which, now I'm done suctioning this patient. So the next thing is for me to off the suctioning machine. Now I'm done suctioning this patient. The next thing, remember, this is an unconscious patient. Of course, the patient will not open his or her mouth for you. So what you have to do is to place the mouth gag, remember. So you have to come to the patient side. Remember, you have to put it this way, right? Put it in the patient's mouth. Press this button, and then turn the mouth gag this way. Now your patient's mouth is in place, right? Your patient's mouth is open. So the next thing now, you have to roll the gauze, right? You have to roll the gauze round about the forceps that you are using. Remember, do not leave the metallic aspect of the patient, because there's this tendency that you will injure the patient's mouth without you knowing. So you have to wrap the gauze around like this, dip it inside the mouthwash, use the dissecting forceps, to press excess fluid. So then you take it to the patient's mouth. Start from the inside out, clean and clean, clean. Then you drop, discard it inside a receiver for used swab. Then pick next gauze again. Do the same thing by wrapping the forceps, making sure that you cover everything, the metallic aspect. Dip it also again inside the mouthwash. Use the forceps and press excess fluid. Then clean the patient's mouth. And in case the tongue of the patient is falling back, you can use um, tongue depressor and press the patient's tongue this way. Press the patient's tongue and then wash the inside of the mouth of the patient and the tongue also. So you keep doing this. You keep then doing this over and over again till you have the desired result. That means till the patient's mouth is clean before you stop the using the gauze, right? So now let's assume I am done using this faucet. I also discard it in a receiver for used instruments. So the next thing now is to give my patient lip care. I will use this towel. Mm. While I'm done, before giving the lip care, of course, I'm going to remove the mouth guard and I discard. Then I use the face towel, clean my patient's face. I will do it this over again. Then when I'm done cleaning, I also discard it. Then I also apply. Remember, you have to lubricate your patient's lip if the weather is dry, most especially in my country now. Maybe the weather is dry, so I have to apply Vaseline to lubricate the patient's mouth, right? To lubricate the patient mouth. Remember, this patient is unconscious, so the patient is dependent on the nurse, isn't it? So the next thing is for me to remove the dressing Macintosh and dressing towel. Also discard it. Make my patient comfortable. Making sure that the patient is comfortable. And if the patient is due for changing position, because he's an unconscious patient, I use this opportunity also to change the patient's position to left lateral or right lateral, and I'm done with this procedure. The next thing is for me, so I'm done with this procedure. I have to remove my glove, my used glove. After removing, then I discard it inside a bin for used glove. Then follow me so that we'll go and perform the next hand hygiene after the procedure. When I perform hand hygiene, so the next thing is for me to record the procedure. Remember, in nursing, any procedure that you as a nurse did not record, that procedure is not being carried out. So carry your pen and record the procedure, the time, the procedure, and any other observation in the patient's mouth. Is it rash, cracked lips, whatever that you have observed? Record them appropriately. And in case you are using system, most hospitals these days they don't use manual like file and paper to record. You go to the your system, the computer, and then impute your what you have done, the procedure you have carried out. So this is, I hope this video it's helpful. Please do not forget to share it to your colleagues. Do not forget to share to nurses, students, nurses. I hope it's helpful. Watch my next video. I'll keep you updated.